Hello, everyone, and welcome to the second session of the Asia-Africa Period Summit as part of the Maasika Mahotsav Festival to celebrate periods. Organized by A Period of Sharing and Muse Foundation, we are thrilled to be in conversation with friends and fellow menstrual health workers from across Asia and Africa. Today, we will be understanding the impact of COVID-19 pandemic on menstruators. We are joined by an inspiring panel of menstrual health management experts and ground workers. I welcome Swati Singh, Director and Founder of Muhim Welfare Society. Hi, Swati.
Hi, Anjali.
Great to have you.
Thank you so much for this opportunity.
I also welcome Patricia Mboya, from co-founder of FemSpur. Welcome.
Hi, how are you, Anjali? And I'm so excited to be here. Thank you so much.
Great. Hi, Stephen, Stephen Nzuza, who is the Director of Teen Pregnancy Awareness from Kenya. Welcome.
Hi, thank you for having me. I'm actually very humbled.
And welcome Diane De Menezes, founder of Red is the New Green.
Hi, really nice to have you. Thank you. Thank you for having all of us.
Thank you. So before we begin the session, I would like to set some context and share a few notes and overview of the session. So before we start, a quick note, we will be using the term menstruator to refer to everyone who menstruates, as not all menstruators are women and not all women menstruate. Today, those who do not menstruate will be referred to as non-menstruators. So the main themes that we will be looking at today are: 1, the COVID lockdown and the impact on menstruators; 2, the plight of menstruators in rural India and those who are migrants; 3, the problems faced by adolescents; 4, menstruation as a human right and policies surrounding menstruation; 5, COVID healthcare workers and their menstrual hygiene and access; and lastly, issues in urban slums and the need for sustainable menstruation during this pandemic. So to set some context, we are all aware of the devastating impacts of the COVID-19 pandemic on society across the world and all of our systems, especially the healthcare and the bureaucracy systems. We are facing a crisis at a scale never before experienced. And while the devastating effects of the pandemic are widely observed, one of the issues that has fallen through the cracks is the aggravated impact of reverse migration on menstruators in rural India and healthcare workers across. However, while menstruation remains a crucial issue, it is not widely addressed in connection with the pandemic. While scientists are still looking into the biological aspects of menstruation, the socioeconomic aspects have been severely impacted. For example, period poverty is once again on the rise. Lack of nutrition has aggravated health conditions such as anemia and malnutrition. Taboos and stigma still prevail, and access to infrastructure, water, clean sanitation are all a sustained issue, among others, coupled with the COVID-generated waste. Menstrual waste is also rising, and our waste management systems based on caste, manual segregation, and landfills are breaking down. Migrant laborers and women are being forced to undertake reverse migration due to our economic structures, and this has impacted their ability to safely take care of their periods. Even doctors and nurses treating COVID-19 patients are struggling and fighting through. So today we will uncover and talk about these stories. Last year, when the first wave of COVID-19 broke out, the state imposed a lockdown. In India, this led to over 600,000 people being forced into reverse migration back to rural India. They had no food, shelter, livelihoods, healthcare, or access to basic facilities, and many walked hundreds of kilometers barefoot to get home. This exodus had a large impact on menstruators walking back and in rural areas. I am pleased to introduce Swati Singh, the Hindi editor at Feminism in India and director and founder of Muhim Welfare Society based in Varanasi, who will share her experiences and thoughts on this. Last year, Muhim worked tirelessly to help migrant workers and those living in rural urban slum areas in Varanasi. Swati has done the research for What Women Want campaign, and her articles have been published on various national platforms. She has also written a book in Hindi called Control Z. Welcome, Swati. And we're excited to hear from you.
Thank you, Anjali. Thank you for this opportunity. Yes, myself Swati. I'm from Varanasi, and my organization is based in Varanasi, which is working from last 6 years in a rural area, basically with the women and adolescent girl on the topic of sustainable menstruation, gender, and sexuality. So yes, as Anjali said, last year we have done lots of relief work with migrant worker and so many needed poor and vulnerable families in rural area. And during this relief work, and now we also keep doing our relief work in this year, and we are seeing the problem in a grassroots level related to the sustainable menstruation and women health. So last year, due to lockdown, we saw a terrible picture of migrant worker when millions of people returned from cities back to their villages with their family. But during this period, no specific research or report was prepared on the number and status of migrant women. Our country, where even today, women are forced to have their food last in their homes, their nutrition issue is missing from our food menu. In such a situation, when we talk about the migrant women in terms of menstruation, then some points, some important aspects related to the situation of women in rural area are revealed. So first, as we observe in daily basis, we are keep observing in rural area, the direct impact of the financial crisis is visible in the health of women when they are forced to cut their food and nutrition to feed their family. So this is the first impact we are seeing in a rural area. Second, due to the COVID-19, the prices of vegetable, grains, and fruit has been greatly affected, which has also limited its reach to the family. And also, as we know, when we are saying family, women are is the last part of the family. And third, we observe the issue of increased domestic violence cases during COVID-19 was highlighted to a large extent. But due to financial crisis, violence on women's basic need was not recorded anywhere, especially in the context of health and hygiene. Fourth, we are saying toilets are still not available in every houses in rural area, and the families where toilet are available, they are outside from their houses, and in a big family, there are lots of family members, there are only one single toilet. So in such a situation, women's access to toilet has also become a very limited, and it also affects the women's health during the pregnancy, during the menstruation. They don't have a clean and also the access to the toilets. Fifth, we are saying due to the financial crisis, women have started restricting their use of so-called expensive as sanitary pad. Like in rural area, women did not found, okay, sanitary pad is our basic need. They are thinking, okay, this is the like extra budget, extra thing for us. So due to the financial crisis during this phase, we are seeing they are also reducing these things due to financial crisis, and because of this, there are lots of infection problem and health issue are emerging in rural area. They have a lots of problem of white discharge had increased, and so many infection related to the menstruation problem has increased. And sixth point, like last year and this year also, we are seeing that sanitary napkin is not available in medical shop. So the in rural area shop are very limited, and in those shop last year and this year also, the sanitary pads and menstrual management products are not very available in the rural area. So those women who are capable to buy the sanitary pad, due to this condition, they have money, but they are not able to had a sanitary napkin from the medical shop. Next point, since the issue of menstruation is being discussed in India, sanitary pad have become to be seen as its solution. Like the projection nowadays in India, menstruation seems to be a problem and sanitary pad is like a solution, which started the initiative for free distribution of sanitary pads. But without the availability of panties for this, there is no use of sanitary pad. Like we are seeing so many people, so many organizations and also government has started so many campaigns to providing free sanitary pad. But they did not talk about the panties. So without the panties, sanitary pad are useless. Like in rural area, women don't have a panties, they don't have access of it. So if we are providing them sanitary pad without panties, so there is no use. So yes, we are seeing this problem also. And the last point, special nutrition and hygiene for women and adolescent girl, it is still not found in our relief kit. Like last year and this year, so many organization and government has started relief work. They are providing food and they are providing COVID related hygiene things, but especially focus on the women health and hygiene. Those material are not found in our relief kit. So these are some observations which we are seeing in rural area with migrant women. So yeah, overall we can say that this during this pandemic has pushed women back a century. Like in Indian patriarchal system, women condition is still a big question in the context of health, security, their economic independence. And now in rural area, men have now returned to work in their cities, but women are still forced to live in their village. And there they don't have a proper source of income. In rural area, they don't have a proper home and health and education facility. So due to this, their livelihood is directly affected during this situation. So this is all which we have observed, and yeah, so thank you.
Thanks, Swati. Can you also tell us a little bit about what were the conditions that women faced while they were migrating back? And did they have access to sanitation, to facilities, to products?
Yeah. So we are keep following the migrant women who are coming back last year to their villages. We are seeing in rural area, when women has came to their village from like after 5 or 10 year back, they don't have a, like they are not able to claim their space in their family. So they are unable to claim the toilet because there are lots of female members who are living in their place from a longer time, and suddenly a woman which is also a part of their family, they came back from like Mumbai and Delhi. So yeah, so the migrant women who has came in a rural family, they are unable to claim their space in the basic need related to the menstruation and also the toilets. So like there are 4 women in a family. So new women who has came from the city due to the COVID-19, they are not very allowed to have a proper access of toilet. So toilet is also still like a property kind of thing. So first we are seeing this issue, and second also the same tendency in the context of nutrition. So yeah, now in a rural family there are lots of family members. So women are forced to cut their food due to the COVID-19, and in the name of COVID-19 they are facing a huge financial crisis also. So we are seeing these things who are coming back, and women who are coming from cities, they want to do something because they don't have any source of income. They want to be economically independent, but from the government there is no scheme. Last year government has made some plan for the migrant worker, but not for the migrant women. So yeah, women has a no economic thing, and economy is a big issue. If we have a money, then yeah, we can think about our health and hygiene. So we are seeing the condition of migrant women are more worse than the rural women.
Right. And I think last year when the lockdown had initially started, there was also a lot of outrage because sanitary napkins were not made essential products.
Yeah.
at the start of the lockdown, when I remember. So were there any challenges that you faced, your NGO faced with this and with regarding providing products and infrastructure to those who are actually walking back?
Yeah. So yeah, we have planned our last year. We have make a proper kit for the migrant women, in which we have put panties and sanitary pad, also cotton sanitary pad. And our whole work was on the base of crowdfunding. And we found when we started asking people for the sanitary pad and panties, we got so many trolling kind of thing from social media. People started talking about, okay, people are dying from for the food, and you are asking for the panty. So yeah, it's very difficult in an Indian society to realize people panty and sanitary pad is a very essential product when we talk about any relief work. So and also some of our NGOs partner in that time, they are also have so many, they created so many problems because we choose this product to include in our relief kit. So we are saying, okay, we are working in a women empowerment on women issue, but when it comes to the implementation, especially when this kind of pandemic has come, we can see, okay, how much we are sensitive and how much our way of thinking are broader to see and addressing the problem related to the women health and issue. Like last year we observed, when we say we have to work something for the women health, all the people have started saying, okay, we have to work for the pregnant women. And like, yeah, this is the also way of thinking of our government. They always providing nutrition thing only for the pregnant women, but we have to realize that we also need to provide nutrition thing for our adolescent girl and also women. Like Dalit women don't have access for the proper food. So yeah, we are seeing so many problems, and in Indian society to raise the issue of women health, especially in the time of pandemic, it's very difficult.
Right, definitely. And just to connect it to this year as well. So obviously the migrant crisis was in media all over last year, and a lot of people knew about it, but it is also happening this year. It is just not, in media as much. So to this year, what do you feel are there any different challenges which have been raised with regards to women who are migrating back or in the rural areas, especially considering COVID has much more deeply reached rural areas now, and medical facilities are a huge issue across the country?
Yeah. So yes, we are seeing like this year, we are seeing so many cases in rural area also. So the health question is very high, and especially in the perspective of COVID-19. So in rural area, we are seeing women, those who has a infection problem and other health issue, they don't have a proper center for these things, because all there are very limited health center, active health center in rural area. And now this time, all these health center are covered for the COVID vaccine, for the for COVID treatment and testing and all. So yeah, we are seeing the access of women for the health facility in rural area are very limited, and there are lockdown also, so they don't have access to go from one place to another place. So we are seeing especially the Dalit women and the economically backward women in rural area, their health condition is going very down. And also one thing we are observing, like in media we are seeing so many recovered cases of COVID-19, but we are not talking about, we don't think about the women who are in a house and she is responsible to provide all the food and hygiene thing if a person are COVID infected in their family. So in rural area we are seeing the in a family where there are some people who are infected with the COVID-19, the women condition are going very worse. They don't have a infection. I can't say 100% women get infected, but yes, mentally and physically their health is keep going down, and they are cutting so many things from their nutrition in the name of, okay, my male partner has a COVID infection, so now it's my responsibility to cut my nutrition and provide them, because it's time to immunity boost, they need to their immunity should be boosted. So yeah, we are seeing there are so many houses in rural area, and women and also the girl, like mother and daughter, this is the patriarchy chain. So we are seeing if mother is reducing the nutrition, then their daughter is also reducing their nutrition. They are not ready to buy sanitary pad because they want to save money for the health facility and other thing. So yeah, we are seeing these 2 or 3 problem in rural area.
Right. Thank you very much. Just to summarize some of the main points, you mentioned issues of infrastructure and pads being expensive, not accessible, not having then you also, especially in rural areas, you mentioned not having reports on migrant women. You mentioned that toilets, they're not accessible toilets. You mentioned white discharge, and you were talking about how it's also extremely difficult for Dalit women and women who are economically backwards to get access to so many of these things, and how it is so tied to nutrition. So thank you very much for sharing that.
Thank you so much.
Thank you. So we will now move to Patricia Mboya. Profit social enterprise based in Nairobi, and it's aimed at destigmatizing and demystifying menstruation. It also works to promote dignified and sustainable menstrual hygiene amongst young adolescent girls and women from informal settlements through mentorship on menstrual health management and provision of products such as sanitary towels. So welcome, Patricia. Could you please help us understand the effect of the pandemic on menstruators in Nairobi, and more specifically, the problems faced by adolescent girls due to the outbreak of the virus?
Thank you so much, Anjali. Just like I said earlier, I am so grateful for this opportunity. Part of our work is to have an empowered, equal community where menstruation is not a limitation. And we try and engage the members of the community, parents, community leaders, and everyone, because a child is brought up by the village. And women are the foundation of the community or the family. So we all know when COVID hit, it hit hard. And it hit all of us in all aspects of our life. But the most hit were the menstruators because periods don't stop for pandemics. And where I live currently, I am surrounded by 3 slums. One being the largest dump site in Africa. So, and some of the girls I deal with come from these areas. So some of the observations we made were these girls could not afford sanitary towels, especially during the lockdown. So some of them resorted to using mattresses and other unhygienic products. And some of them even resorted to getting into relationship with older, financially established men just to be able to provide themselves the menstrual products. One example I can give is of this girl that came to us, and as we were talking to her, she preferred getting pregnant instead of menstruating. So when we deeply talked about the issue, she said that 9 months and even more, she preferred to carry the child instead of menstruating. So it was so sad for us, and we did a lot of counseling just to get her out of that mindset. So girls resort to doing unimaginable things during this COVID period. And we know when our government issued the lockdown, it meant that some of the breadwinners lost their jobs. So they could not provide for the family. And if they could only provide for the basic needs. In these communities, they don't believe that pads is a basic need. So some of them preferred to provide food instead of providing for their menstruators menstrual products. So it has been really challenging for these girls, because we try and have conversations. As much as we provide the education on menstrual hygiene management, we also provide products. So some of the challenges that I also want to mention are they had limited access to the wash facilities, the cost of the menstrual products. So when they cannot provide the sanitary products and they cannot access the wash facilities, it only meant for them that stigma is real, and they continued with the shame of menstruating. I can say that as much as our government launched the sanitary program that saw approximately 4 million girls in public schools receive pads, it really didn't provide, just as Swati said, it really didn't provide panties or any other things that ensured that these girls were menstruating with dignity or ensuring that they were practicing hygiene. So that is where we came in, and we tried providing, or rather we provided tissues, the pocket tissues, we provided panties, we provided soap, as well as menstrual products. And I want to mention that during this COVID period, we had cases of very dire situations, in that we had a single mother who resorted to using the child's diaper simply because she could not afford to buy pads. She didn't have money, and we were on lockdown with the COVID situation. So we need to remember that menstrual hygiene plays a big role in an adolescent's dignity. And cultural and social taboos are threatening it. As much as we are having this conversation globally about stigma, different communities have different ways of implementing these beliefs. It is sad that up until now, we have community leaders who still condemn discussions about menstruation. This made it hard for girls to receive sanitary towels from us, and even information, because some of the parents didn't want them to come to our place to get this necessity, because a sanitary towel is a necessity. Any menstrual product is a necessity to the menstruators. So stigma also affected the mental health of these girls. So it has not been easy for us. But yeah, that's all I can share for now.
Thank you. I have a few questions, if you could elaborate a bit, which is, before the lockdown, could you tell us a little bit about how much the situation has changed from before the lockdown and now, and how different was it last year, and has it gotten worse? Are there any new issues that have come up this year with the COVID pandemic?
Let me talk about 2019, because that is when we started our work on the ground. 2019 was a bit easier for us. We could raise menstrual products locally. We could fundraise menstrual products locally within our community. But then since COVID-19, no one was willing to give. It was so hard for us to get the community to give. So we looked for other channels to raise menstrual products for these girls. Yeah. But then let me say, it has actually deteriorated because girls have now issues that are dire than 2019. COVID, the pandemic came with a lot of issues, you know, people losing their jobs. And even during that pandemic period, during 2020, because we're still in the pandemic, during 2020, we had a lot of cases of teenage pregnancies. And we had early marriages for that these girls are going through. And some of the issues that came with the teenage pregnancies were just because they could not afford to buy products for themselves. And some parents were even giving out their children for marriages because they could not fend for them anymore. So those are some of the issues that came to us.
Thank you very much for sharing. I think there's so many similarities also between what you and Swati mentioned in terms of accessibility and in terms of, you know, panties and in terms of the taboos and the importance that it's given. And you also brought up, you know, the thing about how they would prefer to get pregnant than to menstruate. And with that, I think this ties in very much to our next speaker. I come to Stephen Nzusa, who is a community worker with a legal background and the director of teen pregnancy awareness in Kenya. Stephen believes that menstruation should be a human right and that menstruators need a safe, non-judgmental, non-discriminatory environment to go through the biological process. So welcome, Stephen. I invite you to share the work which your organization has been doing, talk about the idea of menstruation as a human right.
Thank you. Thank you so much, Anjali. I'm really humbled to be here. Thank you for hosting us in this. Listening to Swati and Patricia, I think they've put everything in context. More so, Patricia also working within the same environment that our teen pregnancy awareness has been working in. Because Lucky Sama, there's Baba Dogo very close to there. There's Madare very close to there. There's Korogocho very close to there. These are environments which teen pregnancy awareness, 6 years down the line, we've been working in. And not to sound repetitive at all, the same challenges they've shared are the same challenges we've actually been going through while working with menstruators in the different slums. Reason being that COVID itself hit everyone. And I love the way Patricia's put it. Menstruators do not stop even in the midst of pandemic. That is very true. And so the challenges that overtook us all, and also the menstruators, yes, lack of money to be able to fund themselves and buy the sanitary towels. And let me just put it in our own context. We say poverty within the environments that we work in, even before the pandemic, were a big challenge. What about during the pandemic itself? It became more than a dire need. And so the issues of water, sanitation, hygiene became even more worse because at the end of the day, our menstruators could not afford water, could not afford to have better sanitation than how it was even before the pandemic. And the hygiene became a bigger challenge. And so at the end of the day, there's a reason within our organization. We talk about menstruation should be a human right. It is because by all legal framework, the context of a human right is something written and written that does not deter or does not disturb anybody's human dignity. And so menstruation is marriage to human dignity. And at the end of the day, that should be one of the major reasons menstruation should be a human right. And here in Kenya, yes, we do have the Reproductive Health Bill 2019, which did not give us enough reason for menstruators to have peace away from stigma. It just talked about information. There's still more to work on legally so that menstruators might be safe enough, safer environment, and to have what is needed for them to be okay during and even after the menstruation period. And so it's a conversation that is ongoing in between legal minds, policymakers, the government itself, and the legislators. And we love the fact that the gender rule is being implemented, though in a smaller way in the country. This gives us an opportunity to have better and greater voices in this conversation. The reason I say so is earlier on, and Patricia and a lot of Kenyans or in Africa, we can attest to this. Many are the times that the people that have been voted in are male. And male, I say this with a lot of humbleness, might not be the right people to be able to sit in a room to talk about the issues of menstruation. We need quite a number of female voices in their midst to make this a reality. Because at the end of the day, female leaders will understand this better because themselves will be menstruators and they will be talking on behalf of menstruators who are either their sisters, their mothers, their aunties, and quite a couple others. The reason I say so is because for policymakers to understand why we are advocating for the fact that menstruation is a human right, we will need that number of women in such forums and such settings and such positions where they have the power and decision making to help us achieve this. And I believe, and our organization believes, conversations like these, platforms like these, give us a chance to share what we think and what we believe in. And even during this pandemic, with everything that we've been able to try to, and the reason I've used the word try, it's because it became a little bit different than the other times. And Patricia has actually shared before the pandemic, it was easier to even fundraise for such matters. But even during the pandemic, everybody globally is going through something. So it is a little bit hard to actually put this out there because people will talk about food, other people will talk about what they believe is more important and priority than raising the sanitary towers. And so this season itself is also a good season to voice the matter that menstruation should be a human right. Policymakers and the right people should come up with the right legal framework that will help our menstruators to have a good environment. That is because of sanitation. The slums that we work in and even the street families that we work in and the teen moms, there is a very unique angle when you are working with teen moms because even immediately you work with them and after they've given birth, they will still go back to menstruation. And so one of the challenges we've had ourselves is they will prefer something Patricia has mentioned with a lot of sadness. I'd love to repeat it. They would prefer to be pregnant again rather than go back to having the bills of having to purchase sanitary towels. And so I know being a man in this field, sometimes some things hit you and you don't know what to say, how to say it. But when we get platforms where we can be able to voice these matters, like now, we voice them. And so I am a believer that policymakers are there, they need to hear this. We have the gender rule in our country. We need more women to actually vie to get into leadership positions. I am also a believer that conversations, and this is where I'd love just to touch upon a little bit, we need these conversations amongst adolescents so that we've actually faced a lot of young men that do not understand how we put this up onto culture and maybe the environment that they've grown in, that they've not understood on how to respect the season of menstruation on their sisters, either aunties or mothers. And so there's a lot we need to do to spark conversations amongst also young adolescent men to be able to understand what menstruators go through so that we can give them also peaceful environment. These also bring it up because of hygiene in the slums, the fact that people are living in one room. Thank you, Patricia, for sharing. Thank you. I feel repetitive, but that was powerful because at the end of the day, people are living in one room, quite a number of them. And it becomes even a little bit hard to actually find an hygienic environment for a menstruator. Talk of water itself. How do we have policymakers that will push for water in designated places within these environments so that water can be in plenty? Also during this season, water is also needed not only for washing hands because of COVID, but also because menstruators need the water. And so this and a little bit more of what Patricia has mentioned are some of the challenges we've also faced, what we've been able to engage legally and non-legally. And I believe this is the right platform to continue such conversations.
Thank you, Stephen. Could I ask you to briefly touch upon the importance of making period products tax-free as well, especially during this pandemic?
Yes, I think in our country, as a couple of other countries in Africa, maybe globally, they've not realized sanitary towels and what the menstruators need during their season is expensive to buy. The reason I'm saying it's expensive, I'm not saying it's not affordable. It's because I'm imagining even before the pandemic, our menstruators in the slums were not even able to afford food, nor their bills, nor what they need during the season. What about during the pandemic when a lot of them were laid off because they were doing a lot of menial jobs? Most of them were casual laborers. Most of them were trying small businesses. And when all these came down on us globally, them were affected more than any other person. Because of that, I believe they've not been able, and these are, I can talk of a story of a family that we are trying to help in this season, who for the past couple of months from last year to this year, when the family, the breadwinner, the father of the house and the mother were laid off, have been living on handouts from organization and well-wishers. They've not been able to get either back their jobs or implement ideas that could bring in some money. So literally, I'm talking about a family that had a means to survive, but now are beggars in their own standard. This is sad because at the end of the day, how do we expect the menstruators in that family be able to afford? sanitary towels. And so from that, and I believe our government has been very reluctant, or I would say they've closed their ears to the cries of the people that are voicing on matters of menstruation, MHM in general. And or I will say they are ignorant of the fact that it is true. These things are taxed so much as differentiating them with other goods that are tax-free to this country, then these should be a priority. This should be what is tax-free. Even better, even better. I believe these could be supplied within this nation in all the counties free of charge, so that those who can't afford, those who are struggling to afford, and those sometimes who are also engaging in other acts to just be able to afford, can be able to get these products in their hands without the hassle that we put them in as a situation.
Yeah, definitely. Thank you very much for sharing that. And I really can't stress enough the point that you mentioned about needing more women in positions of policy making and positions of decision making with, of course, menstruation and also so many other aspects. So thank you very much for bringing that up. You also mentioned, especially towards the end, that making period products free and making them accessible. I think that's another very essential thing that is not, it is happening all over the world, and we really need to look at this in terms from a policy perspective, how we can make menstrual products more accessible and how we can make it more dignified. So your point about making it a human right is, I think, one of the most important things that we need to address today. Thank you very much.
Thank you.
So moving forward, as I mentioned earlier, and as we are all well aware, our doctors and nurses have been working tirelessly to help us battle this pandemic. And during this, menstruating healthcare workers have been at the epicenter of period-related issues during COVID, and many of them have struggled to manage their periods in a safe and dignified manner. So I invite Diane Dimenezes, an inspiring MHM worker and founder of Red is the New Green from Mumbai, to share her experiences and thoughts. Red is the New Green is an award-winning social enterprise which works towards reducing period poverty via education and advocacy. Diane is a recipient of the Queen's Young Leader Award and Forbes Under 30 Asia. Welcome, Diane. It's really a pleasure to have you.
Thank you so much. And I think there's very little left for me to say which hasn't already been covered. But what I really want to touch upon is how the pandemic has progressed and where healthcare workers fall into all of this. So while I think right from the start, when Swati spoke about migrant laborers heading back, and then with Patty explaining how difficult it is for women and girls and many menstruators actually to really challenge between actually wanting to have their period, not having the access to the products. Stephen explaining how things are in his country. When we look at our frontline workers, 70%, that's almost one out of every three healthcare workers, there are so many women on the front lines who are helping, right from the doctors to our nurses to our labor staff. In the first wave, and this is just in an Indian specific context, there weren't too many cases in India because there wasn't enough testing and it hadn't spread as much as the second wave. So as a result, there the healthcare workers were able to manage their periods, not easily, of course, not easily, because it was first time in PPE kits, they were struggling to get access to basic pads, and they were experimenting with different period products. In the second wave, which happened in India, I think it started mid-April with early signs right up from from March. Healthcare workers are struggling at the moment to manage daily shifts, to manage access to products. And if you look at a hospital infrastructure, right, they always have access to chemists, they have access to period products. But when a person doesn't have time to take care of themselves because they're so busy taking care and helping save lives, we've reached a point where every single life has to be fought for and saved, it's very difficult to put your menstrual health needs in front of someone else there. So the reason why we need to focus on our healthcare workers is that our infrastructure, very rightly pointed out, doesn't support it. My organization, we tried right from last year when we saw the pandemic happened. I'm based in Mumbai, and it's a city with 22 million people, yet we still struggle with an extremely wide economic gap. You have the richest of the rich and the poorest of the poor in 100 mile and 100 meter radius in some cases. So we saw that during the first lockdown, there were a lot of cases where I think Swati also mentioned it, where chemist shops did not have sanitary napkins. I've seen firsthand where shops have had to ration out sanitary napkins, saying, "Can you just take one packet this month? Can you make do with one? I really can't get stock. My distributors and wholesalers are not coming into the city." I was touched when Stephen said we need more female and we need more women elected representatives. We need more representation there, because when a country of 1.3 billion people exclude an item like sanitary napkins as an essential, I think that really makes us question that we are not looking at policy with a gender lens enough. It's a huge gap on our part, and it was left with many CSO organizations, many non-profits, smaller agencies who are focusing on other aspects to rush and try to fill this gap. The whole of last year, we worked with a lot of products, lot of people, lot of communities, right from the transgender community. We work with women in prison. We work with persons with disabilities, and also some commercial sex workers who struggled to manage their period. I was really happy to see Swati mention the point that underwear is really not openly discussed. When we asked for aid to, get underwear, because we realized women were not using it, we were met with pretty similar responses saying, "Why do you need panties? I mean, why can't you just give them some grains and food and get done with it?" But it's like very simply, you cannot stick a band-aid, or in this case, a sanitary napkin on the problem and really walk off. It's a lot of work which has to be done, and we had to spend a lot of time explaining to people that this is important. We had about 8 million girls in Mumbai getting their period for the first time in the lockdown, with absolutely no resources, no access to education, and that support in that community. So it really made a lot of effort for us to work with different groups, tell them that okay, this is what's happening. So we tried different ways, via WhatsApp videos, via TikTok, via different innovative ways for people to feel like, okay, this is a normal process and I'm not alone. Because in a pandemic, isolation is a very real thing. You feel like your feelings are just your own, and when in reality so many hundreds of people are going through the same thing all at once, menstruation not being one of them. For everyone watching this, I'm sure all of our equations with periods in the pandemic, personally and also in different ways, it's tough. It's really hard to manage your period. And all of us here are on a Zoom call. We're privileged. It's so much harder when you don't have the vocabulary or you don't have the means to express what that is. So we explored a lot of different options with access to sanitary products. I wanted to in fact get one to demonstrate in places where you don't have access to an underwear, where they were not used to it. We got a solution which looks sort of like this. And in cases where they were not using underwear, we tried to give away products like this. In some cases where water was a problem, or in ICU wards which were high risk with COVID patients, we had to resort to using disposable products. And in some cases where water was not a challenge, where drying was fine, we also focused a lot on giving reusable products. The point I'm trying to raise is that there is a different solution available and for different communities. And as educators, as people working with different organizations, and especially as a frontline worker in health, in a pandemic, in a crisis, we need to place the needs of the others before our thoughts, before our assumptions, before what we think, because they know best. At the end of the day, they're going to be using it. So what I'd like to focus on is really putting the dignity back when we talk about relief work, when we talk about helping menstruators in a pandemic or in any other crisis to follow. So I think to largely close, with healthcare workers, what we've seen right now is we're focusing on listening to them, listening to their needs, what they would like better. So a lot of it has changed. It's a very iterative process. So some of them, because most nurses, we realized when we studied, they're a little older, so they're about 40 to 50, they're reaching menopause and they're not very comfortable, or they do not want regular napkins, so they would try to prefer something like a reusable period underwear, or they're curious to try, reusable cloth pad because they've used plain cloths in the past. So it's very important to work with communities, who would benefit from it, and keep iterating the work as we go to ensure that at the end of the day, you're giving them a solution which works for them and not just for you and for your report. So I think I'd like to end with that. Thank you so much for this opportunity, and I'm really glad to be in a panel with such esteemed speakers. Thank you.
Thank you, Diane. I do have one question for you, which is that especially in COVID quarantine centers and currently considering the crisis with the number of people who are also there admitted in hospitals, what have you noticed in terms of facilities for patients and for those who are quarantined to manage their menstrual cycles?
So, from all of our work with various COVID centers, we've realized that there's no facilities for patients. So, if you're in an isolation ward and you say you've got you got your period during that, it's firstly extremely difficult because there are many studies which are happening now to try understanding the effect of the pandemic on periods. So it's very isolating, and they don't have access to products. So, say for example, you're used to a certain brand, or you're used to a certain type of product, and maybe because you get rashes with something, or you're not comfortable in a quarantine center, you don't have that privilege to ask and say, okay, I want this particular pack of 10 with extra large wings and with a cotton cover. Absolutely not happening. You're going to get whatever, say, an NGO provides, or whatever some ward boy can go out and pick it up for you. So that is not having that um, not having that agency to pick your own product is extremely difficult for menstruators in COVID care centers. So right now, what we think works best is we try to listen to their requests. If we could get them something particular they like, and if they have the financial capability, we try our best. Else, we try to find solutions which really work. But there is no infrastructure which takes care of the menstrual health needs in healthcare centers at the moment in Mumbai.
Right. And even, I assume even in places where there are toilets or there are sanitation facilities, they are probably quite dirty and, difficult to use.
Yeah, and we've seen a reported increase of, especially in these healthcare centers. I'm talking about your jumbo COVID centers, spaces where many people are isolating together, people ranging with mild to not so severe symptoms. The toilets are, firstly, not very well kept. They try their best. It's not like the management is not trying, they're trying their best. But it's still, at the end of the day, hygiene is a concern. There are increased cases of UTIs, of various types of infections, and all of it is not getting that much prominence because of the pandemic, but we do foresee an increase in a lot of cases because of the entire effect of last year, with women's health needs being placed to secondary. We do foresee in the next 2 to 3 years that manifesting in various forms, which is very concerning for the public health system, especially in India, and I'm sure globally as well.
Right, definitely. And I think the point that you brought up about dignity for those who do relief work is really important, because when we look at the way that things have panned out, there's absolutely no rest, there's no support system for those who do the relief work. And it's an absolutely sort of work, where there is, you really don't get time to take care of yourself at all. There are so many workers who still don't have vaccines and are going out and working, coming back home and also risking their families and their children, to help others with the COVID. So I think that's a really important point that you brought up. And you also, of course, mentioned not having a one solution fits all. Which again is very important, especially when we look at the kind of relief work that we all engage in, that it's very important that whatever we provide should also be useful for the people who we're providing it to or we're trying to help. So I think that was a very important point that you also brought up. And of course, the need to give priority to this, despite the pandemic. And even though there are so many other issues that also need to be looked at, this is still a priority that we need to keep in mind. So thank you very much, Diane. So we have now looked at the impact of the pandemic on those across India and Africa from various sections of society. And I would like to add to this discussion that with the second wave of the COVID-19 pandemic in India, thousands of menstruators and their families in urban slums have lost their sources of income, as was mentioned by all of our speakers today. And they don't have access to safe and essential sanitary products or infrastructures like toilets, stable houses, water, garbage disposal sites, access to doctors and gynecologists, medicines. These are just some of the issues. And many menstruators are in places dependent on things like wood or cardboard, dirty rags, old gauze, old sanitary napkins, and as Patricia and Stephen mentioned, even preferring pregnancy to menstruating. So they don't have money to buy sanitary napkins or to visit a doctor in case of an infection when you look at these sort of horrendous makeshift solutions. So I would like to share a little bit about my experience working on ground. I'm a social and environmental activist and a co-founder of the project Amara, which is based in Pune. And we work on providing sustainable and equitable menstruation for everyone, regardless of their background or demographic. And we believe it to be an essential right that all menstruators have. So during the pandemic, we were working mainly in urban slum areas in Pune, and there were a number of issues that were raised here as well last year, as well as this year. It's ongoing. One is definitely that has been covered a lot, which is the issue of infrastructure and toilets. A lot of Basti areas, Bastis are urban slum areas, do not have clean toilets. If they do have clean toilets, they'll have a shared toilet between 200, 300 families. And many menstruators do not prefer to use such a toilet because it makes them want to physically puke. So that is one very big issue. Then, of course, as mentioned, pads are also expensive. They are very expensive. They're taxed in many places. There aren't shops where you can buy sanitary napkins. Last year, when it was not an essential product, that was even worse. There's no access to gynecologists for many of these menstruators living in urban slums. And with the lockdown, there has been also the issue of domestic violence that has increased a lot. And with the men always being home, a lot of the menstruators feel very conscious if they're using rags to dry them. So there was already a lot of taboo, but it's getting worse now. There's also an issue of money management. So earlier, a lot of menstruators used to keep aside some money to buy their own products. But with the men now always being home, it's very difficult for them to do that as well. And of course, this has taken a huge toll on their mental health for those menstruators who are living in such spaces. They barely have like 10 by 15 rooms, which houses 5 to 6 people, has no toilet in it. And this becomes a huge issue. And as Swati had mentioned at the start, of course, the nutrition aspect also comes in, where if they're not getting ration, the ration distribution is very poor right now in most places, and many people don't even know where to buy the ration or get the ration from. So without any ration and any source of nutrition, they are facing more issues of anemia and heavy flow and cramps. So these were some of the issues. And then we realized that when we started initially distributing cloth pads last year, another issue faced was that those living on the ground floor didn't have access to sunlight, or they had very dirty water because they were living next to a sewage system. And these kind of issues were also difficult with because they at the same time also had a lot of clogging with regards to sanitary napkins and other forms of trash. So there was this dual issue of how do we give cloth pads, which they can find a place to dry in the sun, but at the same time not give sanitary napkins, which are making the trash issue worse. So obviously with COVID-19, there has been a lot of trash generation, and along with the sanitary napkins just being unsustainable, unhealthy, and a huge financial burden, they're also clogging a lot of drains and becoming a huge health hazard. And they're adding to the medical waste, which is causing a lot of incinerators to break down, at least in Pune and in other cities as well. So like Diane mentioned, it's not a one solution for all, but we have to find a way to also look at this aspect of menstrual hygiene management, because the garbage is only going to increase, and waste management is not at all a dignified livelihood at the moment. It's a huge task for many workers, waste workers who have to pick and touch use sanitary napkins and collect them and segregate them. So this also remains an issue, and we need to find a sustainable yet a way that works for the different needs of different people across society. And with this, I will end here and summarize the discussion from today that we have looked at so far. A lot of important points were brought up and a lot of similar threads running through the entire conversation that we had today. Certainly, we had the conversation of, we had policies that were brought up, so not enough menstruators actually being in the policy-making position, and this is leading to either lapses in policy, ignoring menstruation as an essential part of any policy, especially in a crisis management. We also had the issue of not having infrastructure, not having toilets, not having water, and not having access to sanitary napkins or any other period product, because either the shops are limited or they're just not available. Another issue was the idea that people don't understand why we need to fund panties and why we need to fund sanitary products. So this also becomes a very big issue, because if you don't have a panty, you cannot use a sanitary napkin. So there were, we spoke about that aspect of it. Then of course the medical aspect, not having access to gynecologists or other doctors who can help in case of excess white discharge or having infections or health and malnutrition issues, which also ties into not having access to food in the time of the pandemic. So that part also comes in. Then, of course, there is the issue issues that adolescent girls face, and both Patricia and Stephen highlighted the shock. It's truly shocking, idea that they would rather stay pregnant for 9 months than menstruate, and that is how difficult and how difficult it is for these menstruators to actually manage their periods. So I think that is another huge aspect that was brought out. And of course, with more people losing their livelihoods due to COVID and due to so many people being laid off and so many businesses being shut down, there's less and less revenue that is coming into houses, and menstruators are finding it even more difficult to actually get products, have access to them, and also get the food and nutrition that they need in order to sustain themselves. So this becomes another very, very important aspect. Deanne specifically was talking in terms of healthcare workers, the frontline healthcare workers, and how even in that aspect, we need more dignity of labor and dignity of those who are helping others. Even in times of crisis, we need to have more crisis related policies and efforts from those in the government, from those in the policy making spaces, so that we can ensure that everyone can manage their menstruation and their other requirements in a dignified way, regardless of whether they're a healthcare worker or if they are someone living in a rural part of a country, or if they are adolescent, or if they are just anyone. Everyone needs to have a dignified way to deal with it. So this was another very, very important point that was brought out. And lastly, we spoke about, of course, there was the part about how we also need to look at, when we are doing relief work, not a one solution fits all, and there needs to be a diversity, there needs to be a dialogue, a conversation about the taboos, about the solutions, and about the issues that people are facing, so that we can have solutions, we can move forward with policies and solutions and implementations which actually help those and help the issues, help solve the issues in a way that it is holistic and it actually addresses what people are feeling and facing. So thank you very much to everyone, to all of our speakers today for sharing their thoughts. I now invite each of you to take the stage for a few minutes to share your call to actions. So Swati, would you please like to go ahead?
Thank you, Anjali. So yeah, when we talk about after so many problems, and now we are coming to our solution, what we are doing in our grassroots level. So yeah, in this time, like in this year, it's very difficult for us to like do so in relief work in a very larger amount. But yes, we are keep doing our relief work, not only relief work but also providing them counseling, and also trying to connect women, especially rural women, to the basic health facilities. So yeah, as we got this point from every speaker, it's very difficult to raise fund in this year for relief work, and especially for the menstruation menstrual related product. So but still we are keep doing our work, and we are focusing to make more cotton sanitary pad, which are very popular in a rural area, especially in Uttar Pradesh, in our district, where cotton is very easily available. And we are seeing so many women know the basic stitching things. So we are trying to train them to make their own cotton sanitary pad, they can reuse. And like in this time they can maintain their hygiene also. And this pad also help them to fight back for the financial crisis, because in medical shop the availability of plastic pad is not very good, and also the financial condition is very worse. So yeah, we are keep trying to make a very small group of women and train them to make sustainable cotton pad. And also we are trying to promote the tendency of hygiene, and make more vocal on this topic. Because when we see the main cause of the problem is in India, in rural India, yes, menstruation is still a taboo. That's why this is not coming to very like very strongly in our relief kit, in our policy, in our shop, in every places, especially in our discussion also. So yeah, this is how we are keep doing our work. Thank you.
Thank you, Swati. Patricia, floor is yours. You are on mute.
Okay. Yeah. Thank you so much, Anjali. Uh, is it the call to action that I'm talking about?
Yes.
Okay. So, so I'd really like the government, not just ours, but across the globe, uh, that they should prioritize menstrual hygiene enough to make available products in all public facilities. If not, poor sanitation and health risk will continue to threaten our girls and women, or sorry, menstruators. So I think all the governments should actually prioritize, because menstrual health affects the daily ongoings of a menstruator and the mental health. Um, we should also work together to normalize periods. We have to keep the conversation alive, just as Steven said. Let's keep the conversation alive. This means having conversation with all genders, even those who don't menstruate. Yeah. So being comfortable about periods dismantles the stigma around menstruation. So yeah, that is all I want. That is actually my call to action to everyone. Yeah, thank you.
Thank you. Thank you, Patricia. Stephen?
My call to action will be to the government, legislatures, policymakers, people in power, people in positions of influence, organizations, and institutions that work around women and solving women issues. All of them to come together, to work together, to implement solutions around women and menstruators, because a lot of conversations have been ongoing across the world, but nothing is being implemented in countries like ours. So I believe it is time for us to implement the fact that we are able to distribute tax-free sanitary towels. Yes, it is possible. it is now. We are capable of also implementing as a law the fact that women menstruation should be a human right. Also, I believe as a country, as a nation, as a continent, and the world at large, we are able to work towards creating a better, safe environment for women to thrive, either in workspaces, in getting positions, or better, coming up with businesses that we can support so that when women are supported, it is true, when women thrive, the whole community thrives. Then this is what I believe in, and this is my call to action. Let us support.
And Deanne, moving to you.
All right. So I think it's very important for us as practitioners, as people who want to do good, to keep the people who we're doing this for in mind, to be mindful about creating solutions which actually help them and not just help us. That's one point. Another point is, if you're based in Mumbai or anywhere across India and you do need access to getting period products for various groups, so you can always reach out to our organization Red is the New Green via Muse, via Maasika, Mahotsav, and we're happy to help you or guide you to get access to these products or resources. I think it's very important at a time like this for everyone to come together. It's always important to collaborate, learn, and improve, so that when we have natural disasters or climate crisis or anything that comes our way, we'd be able to work in a more efficient way and make sure that we're helping those in need. So thank you.
Thank you, Deanne. And just to add my little bit here, from the project Amara, our call to action is, if you are in Pune and you can and would like to help us on ground with distributions, we are doing cloth pad distributions, please do get in touch. And if you are in the space to donate and you can sponsor, you can help us sponsor some of these cloth pads as well at Linktree/the project Amara. So thank you very, very much, everyone. I want to give a huge thank you to all of the speakers today who joined. It was really inspiring, and I learned a lot listening to you, listening to your experiences over this pandemic, and the different ways that different menstruators from different backgrounds have also been dealing with this pandemic and their menstruation. So it has been very, very insightful. And I am sure that those of you listening would have also learned a lot. And please do try and keep the conversation alive. Please try and engage with this further. You can read more about it. You can follow any of the organizations who spoke today, any of the people who spoke today. I'm sure you can get in touch with any of us if you'd like more resources, if you'd like to learn more about it and begin working in this space and working for better menstrual health management. I also want to stress that thank you very much for joining us for the Maasika Mahotsav event today, because even in this time of pandemic, it is extremely important that we talk about menstruation. As we heard today, there are so many issues that menstruators are also facing, and we must address them even during such a pandemic and such a crisis. So it's very important that we celebrate periods. We talk about the taboos, we talk about the issues that we're going through, and we also talk about the beautiful aspects of periods and menstruation, which we can all relate to, and we can all understand and celebrate and enjoy, smile with. So thank you very much for joining us today. I want to give a huge thank you to Muse Foundation and A Period of Sharing for organizing this. We have a lot more events lined up in Maasika Mahotsav. All of the organizations who are part of Maasika Mahotsav will be hosting some wonderful events over the next few weeks. So you can follow Maasika Mahotsav on Instagram and on other social media platforms for more updates. And we hope to see you there. Please do join us, and do join us in the next talk as well in this series, in this Africa Asia Period Summit, which is on period taboos and regressive practices in the 21st century, which will be tomorrow at 6 p.m. Thank you very much again to everyone. Take care and stay safe.